fluid that the uterus secrete. There's some fluid that the uterus secrete. Now, this fluid is called the uterine milk. Sometimes uterine milk, sometimes they call it uterine fluid. So this fluid will now go inside the morula, the compact cells, the morula, and now differentiate the morula into two things: the embryoblast and the trophoblast. The embryoblast can also be called, and look at number 5. Look at number 5. The embryoblast can also be called the inner cell mass, and the trophoblast can be called the outer cell mass. How did it displace the embryoblast to one side, and how did it displace the trophoblast to one side? It is because the cell of the outside of the morula, the cell of the outside, the cellular cells that is located outside, it is made of a tight junction. While the inner cell mass, the cell in the middle of this morula, look at the morula, yes, the cell in the middle is made of gap junction. And you understand from the knowledge of your histology that gap junction does what? Allow something to pass through. While tight junction is very, very tight something. So at that period of time, it can push the inner cell mass to one side because of the gap junction, and is not able to push the trophoblast. So the trophoblast will still remain its position. So that's how it creates this cavity. And this cavity is known as blastocole. Blastocole. So this is week 1 development. So from there, you can see the picture of week 1 development. You have the embryoblast, you have the trophoblast. Yes, that's still the end of the week 1 will form embryoblast and trophoblast. This is something that you can see using the microscope. If you use the microscope, this is what you will see. So from there, we enter into week 2 development. In week 2 development, what happens is that everything will become 2. The embryoblast that we form in week 1. The embryoblast that we form in week 1, yes, will now become 2. The embryoblast will now divide into, look at the something bluish structure here, they call it all bones to do what? To stay there. Now, this fossa we are talking about in this ileum, this fossa is to allow muscles to stay there. And the name of that muscle in that fossa is called what? Iliacus. It turns the gap of the iliac in the ileum. Posterior to the ilium. Posterior to the ilium, we have what we call the gluteal region. The bum. The posterior to the ilium. In the posterior to the ilium, there are some things that makes up the posterior part of the ilium. There are some lines. I know you know that line. The line are what? Anterior, posterior, and inferior. If you look at the posterior part of the gluteal,